And I'm going to start. Okay.
Oh.
Okay. We should be live on YouTube right now.
Excellent.
Hello, good morning. My name is Alicia Wolf. I am here trying to. Okay, had to mute myself there. I am Alicia Wolf. I'm from the dizzycook.com, and I am here with Dr. Shin Beh of the Beh Centers for Vestibular and Migraine Disorders. Dr. Beh is from Dallas, Texas, where I am as well. And conveniently, he is also my neurologist, which is how we have met and known each other for the past 6 or 7 years. So I am actually one of his patients who have since graduated, sort of, but we still keep in touch for life events and everything like that. And he has been kind enough to come in and do this meeting for us today and talk about all things vestibular migraine. So we've done 2 previous videos together over the past few years. And so I recommend if your questions don't get answered today to go back and review those videos. But we got over 500 questions from readers and patients. So I tried to limit them, condense them into condense similar questions so we can get to everything. And then ones that have already been answered in previous videos, you can go back and reference. So thank you for joining us today.
Thank you for having me.
So I want to start out with the question. A lot has changed over the last few years when it comes to migraine. What are some new things that are coming out about vestibular migraine specifically?
So within the last few years, the good thing is now, there are more, formal diagnostic criteria for vestibular migraine in children. So, below 18, in the 2012, the criteria came out for adult patients, but now, we have basically the same criteria being applied, to children. So, it's being recognized that, children can also experience vestibular migraine, something we already knew, but now, there's this formal, criteria that has been put forth. And so, I think that is good because then it also opens the way for, insurance approval for any like medications and, for further studies into vestibular migraine in children. Another very interesting development, I'd say, over the last few years would be in the recognition of, the role of CGRP. In vestibular migraine as well. The vestibular system is covered in CGRP receptors, right? And the vestibular system interacts very heavily with the trigeminal system, also covered in CGRP receptors. And so, although it's not surprising that, CGRP plays a role in vestibular migraine and migraine, it's good that, we have some confirmation of this relationship.
Wow. Okay. And we are going to get to CGRP later, but I did want to ask you, we are seeing, there was a paper that came out that Association of Migraine Disorders kind of sent out to everyone. And it was about a few of the doctors who got together and your name was on it. And talking about how the gaps in care basically for vestibular migraine. What exactly are you seeing there and what are you trying to change?
So I think the biggest gap we have, of course, is, vestibular migraine, if you compare it to, our more traditional understanding of migraine, right? So the traditional one is the headache. So a lot of the studies in migraine focus a lot on headache and, most bothersome symptom during the attacks, right? So, and the most bothersome symptoms typically have been light sensitivity, sound sensitivity, nausea, and vomiting.
Yeah.
I think the big takeaway from that, helping with that paper was that, we still need to develop, methods of trying to quantify, vestibular migraine, right? To figure out, what symptoms to track. And I think that is a big part of trying to understand the condition and for studies, because, although we understand the symptoms, like, personally, right? the part that we need to try and capture is, a quantity, right? To try and have some form of quantification for the data, right? To show, because if you have a clinical trial and say medication X, we want to be able to show that medication X reduced the severity of the disease in a particular way, right? Either in the frequency of the attacks, the severity of the attacks, the duration of the attacks, things like that, or even the symptoms that happen, in between the attacks. I think
Yeah.
one of the very, confusing things about vestibular migraine is the huge variety of symptoms, right? Some people have vertigo, some people have dizziness. Among the, even in vertigo or dizziness, there's this crazy variety of symptoms, right? Some people have the spinning, some have the tumbling, the falling, the shimmering, the floating, the flying, the all kinds of things, right? The ground moving, and
Yeah.
looking at things make you dizzy, moving your head around makes you dizzy. I think, that makes it more complex in that sense to try to capture, what we are tracking, right? Because if you just ask about spinning, for example, not everyone has spinning. And so that may not be an accurate
Okay.
way to, and you may lose patients because of that, right? You're not including them in the trial if they don't experience spinning.
So compared to just someone having head pain, that's a lot easier to track than
Exactly.
all the other vestibular symptoms. That makes a lot of
Exactly.
sense. Never thought of it
Yep.
that way.
And the other thing too is even if you're not having an attack, you're still
Yeah.
dizzy. Most people are still dizzy, looking at things that are moving too quickly, talking to people like me who move around a lot, going to the store make you dizzy too. And so I think there is that confusion there. So, even if they're dizzy most of the time, how, does that factor into tracking the symptoms?
Yeah, that actually brings me perfectly into our next question, which was someone asked, is it normal for vestibular migraine to make you dizzy all day, every day? She's had this nearly 10 years and every day I'm dizzy. Although it's managed with medication, I just don't understand how I can be constantly dizzy 24/7. Is there any light at the end of the tunnel?
There's always light at the end of the tunnel. But I think that's
Yeah.
not a good analogy to use because that's usually associated with, death.
Oh, yeah.
Don't
Okay,
go
we won't
towards
go
the
there.
light. There is hope. There's always hope, right? And the good
Yeah.
thing is, as you experience yourself, the vast majority of people with vestibular migraine get better, right? It can be horrible in the beginning, but the chances of recovery is extremely good with the right treatment. Um, so to answer that question, it is not uncommon. Most people with vestibular migraine, and you can attest to this yourself, have some degree of dizziness most of the time.
Yeah.
The best way to understand it is, your brain, if you think of it as a volume knob, right? It's turned way up. And so,
Mm.
things that usually don't make somebody without vestibular migraine or without migraine dizzy will make you dizzy. So, most people have some degree of dizziness, right? So on the milder end of the spectrum, things like, going down a hallway that's long with an ugly carpet, hideous walls, that will make you dizzy. Being, in like really, like say going to Costco on a Saturday
Yeah.
afternoon, guaranteed to make you dizzy, right?
Hmm.
And then, there's everything in between, of course. And on the other end of the spectrum, you have, people who have triple PD as well as vestibular migraine. And then you have, in slightly less common than triple PD, you have, mildly deductible syndrome, MDDS, and vestibular migraine. And so there are many things, that can cause you to be dizzy all the time with vestibular migraine. And so, you know, that's where it comes in. We need to take a good history from you, to figure out, what's going on, whether it's a vestibular migraine or vestibular migraine and something else going on.
Yeah, especially, I think we had discussed this in a previous video, but you had talked about the differences between what it feels like to have triple PD and what it feels like to have triple PD and VM versus what it feels like to just have VM. And so, triple PD, I think it comes down to being more of a constant state of dizziness that doesn't really change
Mhm.
versus VM, which has more highs and lows to it. Um,
More or less. One of our patients used a very good analogy. It's more like, the
yeah.
stock market, right? So you have,
Okay.
there's fluctuations like you see in the stock market. So I think that's a really
Yeah.
good way to, compare
That is, they must be in the stock market or be watching it lately.
it, which could trigger migraine too if you follow it too
Yeah.
closely.
Especially lately. What is the difference between vestibular migraine and traditional migraine, and how do you treat both at the same time?
So, traditional, quote unquote, traditional migraine nothing traditional about migraine, right? But our traditional understanding of migraine is more of the headache part of things, right? But as
Right.
we all know, migraine is more than a headache. There's so many things that can happen in migraine. You can get vertigo, dizziness, language issues, memory problems, appetite changes, bowel changes, nausea, vomiting, so many things, right? So just to make it as simple as possible, is traditional migraine, people think of headache. Vestibular migraine, you think of migraines that manifest predominantly with vertigo and dizziness, where headache may be a part of it, but it's not necessarily a central feature of the migraine.
Okay.
Yeah, and how
Um,
do you treat both together? Same treatment.
Same treatment.
Exactly.
And
For the most part.
I think some of the differences are, or there might be differences in maybe some of the treatments or medications you choose based on if someone has headache versus if someone has just dizziness, or is it always just the same?
So there are some subtle differences, I would say. For example, right? So if headaches are a big part of it, then you have certain tools like say nerve blocks, which target numb up the nerves and to help with the pain. Botox,
Okay.
for example. So I mean, Botox I know is a little bit controversial because we've seen some people with vestibular migraine whose vestibular symptoms get better once they get
Yeah.
Botox. Right. And then I do see those who also don't get better with Botox. The trouble is because it's pretty expensive, it's tough to prescribe it to more patients. Even then, what makes it a little bit confusing is the very close relationship between the trigeminal and the vestibular system, right? So if you help the
Okay.
trigeminal system, the activity in the vestibular system also can be altered. A good example is Cefaly device, right? I would have never
Yeah.
imagined the Cefaly device would help with dizziness and vertigo, but it does. Right. So, and the
Yeah.
Cefaly device does not directly stimulate the vestibular system. The Cefaly device stimulates the trigeminal system, which then, alters the activity within the vestibular system. And so I think the relationship is not as, clear cut as that. Nerivio, right? If we talk about the Nerivio device, the one where it goes on the
Yeah.
arm. So that one, from what I can understand, and no, I have not tried it in our patients' vestibular migraine so far, but from what I understand, that one deals more with pain. So if you're experiencing a migraine attack, a headache, and then you administer something, a rather unpleasant sensation from a different part of the body, then that distracts the brain somewhat, right, from the headache, and so that can lessen the perception of the headache. Um, whether that helps with dizziness, we don't know yet. It's not been tried yet, right?
Okay.
But I wouldn't be surprised if it doesn't. I wouldn't be surprised if it doesn't.
Yeah. No, actually, I was going to get to this later, but we might as well talk about it now. We got a lot of questions
Let
about
it flow.
the neuromodulation devices.
Yep.
So, this was actually something I added into my treatment this past year after I had George. I was experiencing influx of attacks. I had a lot of postpartum anxiety. And so I remember we discussed gammaCore, which helps stimulate your vagus nerve. So can you just explain a little bit the differences between Cefaly and gammaCore and how you sort of decide which patients to describe or to prescribe which to which patients?
Got it. So both can work. That's the main thing to
Yeah.
remember. So Cefaly is, the external trigeminal nerve stimulation device, right? So that goes on the forehead. It stimulates the trigeminal nerve, which is the nerve that's responsible for sensation in the face, around the on the covering of your brain, and that's the nerve that's responsible for migraine headaches.
Yeah.
The vagus nerve is the more interesting. So the vagus nerve, comes from the brainstem. It's the biggest of the cranial nerves of the body. So it starts in the brain, travels down, to the neck. It goes to many, many different organs of the body. It goes to your lungs, your heart, your gut, your urinary tract, many different parts of the body. And the vagus nerve controls is a very important part of your autonomic nervous system. Right? Your autonomic nervous system is basically the part of the nervous system that maintains the involuntary functions of the body. So, like sweating, digestion, things like that, heartbeat, breathing rate, all this, functions that are essential for us to survive. You can divide your autonomic system into two parts, right? This yin and yang. So you have your sympathetic nervous system, which, to simplify things, is your fight or flight system. It's the one that gets active when you're stressed out, when George irritates you, you get all worked out,
Yeah.
then that's the fight or flight system. And then of course you have the rest and digest system, which calms the body down, brings things down, helps you mellow out. That's the part that's active when you're relaxed and you have had a good meal and then digesting the food. And so the
Okay.
vagus nerve is part of your parasympathetic system. It is very interesting in the sense that now we're beginning to learn more about its functions in terms of neuromodulation. So
Hmm.
neuromodulation is essentially if altering the brain's activity through altering the function of a peripheral nerve. So in the case of the Cefaly device, you alter the activity of the trigeminal nerve, and that in turn alters brain activity in the back, right? Because you think of it all as a circuit. So if you change the activity in one part, you can change the activity in another part. So with the vagus nerve, you stimulate the vagus nerve on the neck, and that alters the activity in the brainstem. The vagus nuclei are all connected to your trigeminal system, to the vestibular system, and so you can achieve a lot of interesting things with the vagus nerve. Um, it's been studied for many different things. So you have, breathing issues. Like from what I recall, they've studied it in asthma, in COVID. They're studying it in
Okay.
certain, GI issues like gastroparesis, many different things, and even, certain psychiatric disorders like post-traumatic stress disorder, anxiety,
Yeah.
panic attacks, things like that. So the nerve actually has many different functions. It even helps with epilepsy. So in the earliest application in neurology, you have a vagus nerve stimulator that's implanted surgically for
Yeah.
people with epilepsy. And so, you have this can work several different ways. If people feel a seizure coming on, they can trigger it to fire and stop the seizure. Or, you have the device, that can detect when a seizure is happening and then fire off to stop the seizure from happening. Um, and so, it has many different, very interesting functions there, but both, can help with vestibular migraine.
Okay. So it sounds like how do you distinguish, okay, this is what I'm going to have the patient try, or do most patients have an idea of what they want to try? I remember being curious about gammaCore because of that anxiety factor and
Yeah.
also the digestive factor too. I also don't experience a lot of head pain, so I automatically thought trigeminal meant it affected head pain, but I didn't understand that Cefaly can also, that trigeminal is connected to your vestibular system. So this is all very new information, very interesting. So can you tell me how you decide which one to try?
Absolutely. We let our patients decide. It's
You
always a team
did.
effort, right? Yes, you from,
Yeah.
we're working together. I let our patients
Yeah.
decide. So, both can work, right? But like you say,
Okay.
the vagus nerve stimulation may have more benefits, aside from controlling vestibular migraine. So, if you have certain digestive issues, IBS, gastroparesis, a lot of nausea, that could potentially be a good option there. If a person
Okay.
has like a lot of like hip pain, like TMJ issues and all that stuff, the trigeminal stimulator may actually work quite well with that one instead because, you could target more things there. So, I guess also the other issue is price point, right?
Price point.
Unfortunately,
Yeah. Yeah.
healthcare, everything boils down to price, unfortunately, right? So again, that also can be an important factor to consider for some.
Okay, interesting. Thank you for explaining that a little bit better. That's very helpful. We got a lot of questions on hormones and menopause and ovulation and menstrual cycles. I know we have covered this previously in one of our videos, but if you could kind of talk about the correlation between ovulation and menstrual cycles. Someone had suggested they have increased dizziness during those periods of time, but vitamin E actually made them worse. Are there any other alternatives to vitamin E, or is that the one that you generally recommend?
So the changes in hormones definitely big influence on migraine activity, right? So there's
Okay.
some that, and it's usually from it, the change in the level of the hormones, not so much of the actual level of the hormones themselves, it's that fluctuation that tends to cause the issues, for most people.
Okay.
And so, when you're ovulating, there's this change. And then when you're having a menstrual cycle, there's also another change then. So that's why people tend to see the, flare up in their migraine activity around those times in general. Most people is around the time of, menses, but there's, not infrequently, it can happen around the time of ovulation as well. Um, Vitamin E is one that can help. There's the studies that showed, vitamin E, did help ameliorate the effects around their, menstrual cycle. One of the potential theories for that is, it does, block certain like prostaglandin production that could aggravate, migraine, the pro-inflammatory prostaglandins. But that being said, as with everything, right, there is no magic bullet. There is no magic
Yeah.
cure. There's nothing that's 100%. If there's something that, cures everything 100%, then, life will be much easier.
We'd
We
all
won't
be
have
doing it. Yeah.
exactly, right?
We'd all
So
see the
even
same
if
doctor. Yeah.
exactly, it makes it just much, you don't have to see him. Just say, oh, I have this issue, let's go get this medication, let's get this supplement, let's cure everything.
Yeah.
But it's not as simple as that, unfortunately, because, like, we are all different genetically, we are all different,
Hmm.
we are all unique, like snowflakes, right? So
Yes.
the other things that have been shown to help, right? So black cohosh, some people use that as well. There's evening primrose oils, it's been used forever.
Yeah.
Vitex, or chasteberry, also used around the time of the menstrual cycle, which can also
Yeah.
help. Now that being said, the like black cohosh and the chasteberry, they do have hormonal effects too. So, it's better to be careful, run that by your OB-GYN, your gynecologist, just to make sure it's safe. You don't want to run into problems there. And also, you have to also consider if you're planning to get pregnant, or,
Yeah.
if you're not, if you could potentially get pregnant, those are some things that you may want to avoid. Like vitamin A is super safe. There's no, I'm completely not worried about that if you were to get pregnant taking some vitamin E. But some of the herbs, we don't know what could happen, unfortunately. And so,
Yeah.
better to err on the safe side. On the medication side, there are many options, obviously, right? So,
Okay.
one, of course, would be the birth control, right? So, if you have a lot of, severe symptoms around ovulation, around your menstrual cycle, then, you may want to consider getting on contraception. There are many different types of contraception that's available, and, the ones like with the estrogen, tend to carry some risks of, like, blood clots, stroke, heart issues, things like that. But, the lower the dosage of estrogen, usually that lowers the risk significantly. And if you go for
Okay.
the, the newer ones where you have like very low estrogen levels, that may
Yeah.
prevent the fluctuation in the hormones to a point that it doesn't cause issues with your migraine. But, again, always run this by a gynecologist, make sure that, they have the most updated information so they can give you advice in your circumstance, whether it's safe for you to use, not safe for you to use, and what are the other issues. Then, of course, if there are some patients who, estrogen, any form of estrogen can aggravate their symptoms. And so,
Okay.
progesterone only contraception may be useful as well. So, you can think about, there are many, many different options there. For those who cannot use the hormones, sometimes we use, acetazolamide around the time of your period. Sometimes we use the triptans around the period. And some of the new CGRP, the tablets, the G-pens can also be used around your period with great
Okay.
effect. Yeah, so there are many different options that are available, not just vitamin E.
Sort of like a pre-treatment, I guess. You would start it just a few days
Yeah,
or
preemptive, correct. So if you're
okay.
able to predict your periods, then of course it makes it easy. Then you generally can start, a day or two before your period to make sure
Yeah.
you don't run into trouble. But then, if you have, unpredictable cycles, then it makes it a
Yeah.
little trickier. You can still start them when your cycle starts. But
Okay.
it may not be as good as doing it preemptively.
Yeah, okay, that's really interesting. I actually used chasteberry when I was coming off of birth control to kind of
Oh,
help regulate everything again. Of course, you can't use it when you're trying to get pregnant, but it did seem to help me, come off that after I'd been on it for so long. So your dizziness kind of goes like this for a little while.
all the
um,
fluctuation in hormones.
Yeah, yeah, for
Yeah.
sure. Have there been any studies done on vestibular migraine attacks and the relationship to menopause and hormones? I remember when we first met, you said that you typically see patients who are going through menopause or having that change. Is that something you still see with vestibular migraine patients?
Generally, yes. So, yes,
Okay.
generally it's a condition that tends to affect, women at a later age, so late 30s, 40s, as leading up to menopause. And, some of the recent studies as well have confirmed that too, those that looked at, the demographic information of patients with vestibular migraine tend to confirm that, it tends to affect older women. Now, that being said, I think with more recognition of the condition, we're also seeing, younger patients, men, and even some children with vestibular migraine coming in now.
Yeah, I've gotten so many emails from people with young kids, teenagers now, and so it's really, really interesting. And I feel like there isn't enough help for them. I send them all to you, but very, very rarely can I find doctors who will treat them until they're a little bit older. So it's got to be tough.
Once I think you're 13, 14, the good thing is the physiology is similar to an adult already. So, it makes it much easier. Below like
Okay.
age 12 is a little trickier because, you have to consider there are many genetic conditions that can also cause issues like that. And so having a good pediatrician or pediatric neurologist is very important at that age. And then, of course, we want to avoid certain medications, when you're a child, like say below 12, right? You may want to avoid certain
Yeah.
medications that could interfere with development. Teenagers still developing, but it's a little bit easier. They are more or less, adults in terms of their body mass and everything, and so it makes it slightly easier for me. I'm adult neurologist, so it's easier that
Oh,
way.
okay.
Yeah, yeah.
Yeah.
So pediatric neurology, you have to also consider like the weight of the child, in terms
Yeah.
of dosing the medications. Yeah,
Okay. I didn't even know there were
yeah,
pediatric neurologists, so that's
yeah.
amazing. That'll probably help
Different world.
someone on this call.
Yeah,
Yeah.
different world
Uh,
from adult neurology.
right.
Yeah,
No, I imagine it's much more complicated. And I think you're making a really good point that your neurologist, especially as amazing as you are, you have limitations on, the kind of specialty you serve. So, like, there are things that people need to ask their OB about. I learned this
absolutely.
postpartum. I need to ask my pediatrician about things, and they know a lot about medications and breastfeeding. And I think a lot of people think, oh, I'll just go to my neurologist because they know everything and they deal with migraine. But a lot of these other doctors can help specifically for certain questions.
Absolutely. Takes a
Yeah.
village.
Yes, it does. Do you find that there's a correlation between gut health and vestibular issues?
You bring up a fascinating question. Very quick answer is, of course, yes, right?
Okay.
And the more complex answer is, we really don't know exactly what is going on. We know that,
Okay.
gut health plays a huge role in migraine for sure. We're only beginning to understand, the role of gut health in our general health. I mean, there are some bacteria in the gut, some organisms in the gut that have no names yet, right? Because just you don't know about that. But we do know there is a change in gut flora in certain conditions. So in
Okay.
certain autoimmune conditions, for example, there is a change in gut health. And in migraine too, there is a difference in the gut microbiome compared to people who don't have migraine. Now, question then would be, is it because a person has migraine and they're doing certain things, taking certain medications that alters the gut flora, or is it because the pre-existing problems or changes in gut flora increases your chances of getting migraine? We don't know, right?
Okay.
And so vestibular disorders, is a huge umbrella, right? There's so many different things that can influence that, right? So if we talk
Yeah.
about migraine, yes, vestibular migraine for sure, there are changes in gut flora that we see in people with migraine. How to remedy that though is a different question. We don't know, like, because if you look at the probiotic studies, so some probiotics work in some studies and some, don't show that there's much change. So I think,
Okay.
the probiotic, the composition of the gut flora also plays a huge role in terms of, improvement. Another source of vestibular issues that we're seeing more now is COVID, right? So long
Yeah.
COVID, there is emerging evidence that there is a change in gut flora in people who have long COVID. I mean, even
Okay.
there's even some indication potentially that looking at certain changes in gut flora could predict who develops long COVID. And so that, it's very, very interesting. I mean, the gut flora, interacts with your immune system. It has to survive in your gut. And so, it has this, it has to teach your immune system not to misbehave, not to attack it, right? And, so there is an effect. And the immune system also plays a role where it keeps the bad, flora in check, right? So that they don't start to overwhelm the good flora. And so there's this
Okay.
very, very close relationship between the two systems. And, we're only beginning to understand it at this time.
Wow. So, do you recommend probiotics for a lot of your patients, or is it more about a varied diet? Or are you just trying to see, sort of take shots in the dark and see what works for them, or?
At the moment, it's, I think, still pretty, early on, right? So it's very
Yeah,
hard to make like specific recommendations. So number one, we do know that, fiber-rich diet, right? So more fiber
yeah,
in your diet is good for the gut, good for the gut flora, right? So it helps them grow. It's the stuff that, they need to grow. So having, enough fiber in the diet is important, number one. Number two, we do know that, too much, processed foods is bad for the gut bacteria, right? And so, limiting that is also very important. Limiting certain things like the nitrites and the nitrates bad for migraine, also
yeah.
would be important because, guess what? They are the ones that, they will start to interact with the gut flora and, that can cause issues there too in bad cases. Um, when it comes to the probiotics, it's a bit of a tough one because there's different products available, right?
Hmm.
We don't know the details for each one, so it's very difficult to make like a specific recommendation. The not so good part for a lot of people with migraine is, fermented foods are, a little bit of a trigger.
Yeah, for me,
Definitely.
yogurt sets me off every time, even now that I'm feeling better. And that makes it tough
Exactly.
because everyone's like, just eat yogurt,
Yeah.
you know?
All the tyramine and the
Yeah.
fermented foods can be an issue. So, that's the drawback there because, if you want to have like yogurt, kefir, kimchi, sauerkraut, fermented stuff, those, are good for your gut bacteria, but may trigger the migraine. So I'd say like for people who are lucky enough that they don't have those as their triggers, some amount of them, right? To help sustain your good gut flora. But we
Okay.
don't know which other supplements that would work. There's so many different ones out there. We don't know. We cannot say, this works better than this, that works better than that. We just don't have that data, unfortunately.
Okay. That's really interesting. Hopefully next time we talk, we'll have more information on it. That does sort of lead me into my next question. So we got a lot of comments about COVID and vestibular migraine, either people having long COVID and that developed their vestibular symptoms, or they got the vaccine and that sort of triggered vestibular symptoms for them. I guess we'll start with, how have your vestibular migraine patients done with the COVID vaccine?
So majority have been okay with the COVID
Okay.
vaccine. Majority. Right. We cannot say, 100%. There's nothing that's 100%. So
Yeah.
there's some, unfortunately, where it really aggravated their symptoms. And so, it it's not, I wouldn't say it's so much of the COVID vaccine, but I would say any vaccine can do it, right? So any
Yeah.
form of vaccination or any illness, right, can trigger an inflammatory state in the body. That's how your immune system works. That's how your immune system fights off, bacteria, viruses, germs, and how your immune system learns to recognize certain things with the vaccine. So inflammation is part of, your immune response. Unfortunately, inflammation can also aggravate, migraine, right? So,
Yeah.
good example is when you have your allergies, you will also have an increase in the migraine activity for most people this time of year. A lot of our patients, experience an increase in their migraine activity
Yes.
because of allergy. So, inflammation can aggravate migraines. Anything that causes inflammation can aggravate the migraines. The good thing is the vast majority of our patients, after the vaccinations, did not have, severe issues, right? So that part I'm thankful for. Initially there can be a low bump in
Yeah.
their migraine activity, especially, in the beginning, after I got my booster, I got a really bad headache, I was super tired, muscle pains and everything. Lasted for about 24 hours and then it got better. So, during those
Okay.
times, your migraines also can flare up potentially. So, my advice to our patients, with that would be, use your rescue meds. So, your triptans, if you have your CGRP blockers, you can use that too, or, your benzodiazepines, lorazepam, Ativan, and all that to be
Yeah.
super cautious, if you're, since we can plan for the vaccines, the boosters, I have our patients, maybe start using, if they have the benzodiazepine, start using them, a day before, a day or two before, and,
Yeah.
continue that for a couple of days just to, be super cautious. And thankfully, vast majority, they've been pretty good. Right. A lot, unfortunately, after catching COVID has really been a bad one, and it's been the migrant activity has been like pretty bad after they've caught COVID, unfortunately.
Yeah. For a longer, huh? For a longer
Longer
period of
period of
time.
time. Absolutely.
Okay.
Yeah.
That was the same case for me. I actually used gammaCore throughout my period of getting both my vaccines and after getting COVID too, which did seem to
What did you
help.
experience when you got COVID? Like what sort of symptoms did you get?
I was just really, really dizzy, super
Mm,
tired. I did have chest pain, which was a little bit of scary with mine, but the
mm.
dizziness is what really lingered. But I get dizziness with any illness. So, any type of cold or anything, if it goes in my head, my ears plug up. So, I get those plugged ears with almost every head cold. And that seems to be one of my most irritating symptoms of, of these illnesses.
We're seeing that quite a bit with long COVID, unfortunately. So a lot
Yeah.
of our patients, even if they've had it like months before, ear pressure, ear pain, ringing in the ear seems to be quite a big problem too.
Yeah, the tinnitus was pretty loud for a few days, so I had
Hmm.
that as well. But it all seemed to calm down with my rescue medications and my rescue treatment, so that was the good thing. But yeah, it was an experience, and I think it took me almost a month to start feeling more like myself again, and have energy, I guess, basically. I don't know if some of that's just having a baby or if that's that's what's hard to tell.
Do you lose your sense of smells? Do your taste get a wonky?
Yes, so I actually lost my taste and my smell a little bit.
Hmm.
And I remember I drank a lot of green juice and now I can't, like it doesn't taste good to me. But at the time I was like, well, I might as well just down all this like kale juice because I can't taste it. But my
Hmm.
husband said I was over salting food. So it's taken me a little bit to get back to that normal seasoning and not over salting everything that I'm making again.
Interesting. Hmm.
Yeah, I've heard of some people, like some of my food blogger friends, they would have something really strong flavored. So like one of my friends would chew on a lemon every day just to make sure he had those taste receptors so like he could still taste it a little bit. So it's been kind of interesting, especially from a food perspective, because it's a little bit scary to lose your taste and smell. Are you seeing that long
Oh,
term with
yeah.
patients?
So the interesting thing is
Okay.
that your loss of sense of smell may indicate like the more neuroinvasive forms of COVID, right? So because the
Wow.
nerve that controls smell is directly there in the upper part of the nose, and then
Okay.
there's a nerve that travels directly to the brain. And so like
Okay.
so if you talk about like the brain eating amoeba, if you jump
Yeah.
in the water in the summer in Texas, it gets there, and then basically what it does is, it crawls through the nerves to get to the brain and it causes the amoebic meningitis and kills you from that, which is rather
One more
unpleasant.
thing to worry about, Dr. Bay.
Don't be jumping in lake water in the summer in Texas. But you know, the COVID too, if it invades that part of the nerve, and
Yeah.
then it goes through the olfactory nerve and then it gets to the brain from there. The interesting part
Okay.
is, there are people also now with the perverted, sense of smell and taste. So, it's
Yeah.
distorted in a way. So instead of smelling things normally, it changes. So, like people, they perceive like tastes and smells that, were pleasant before as unpleasant. So, what I've seen, like things that tend to be a bit stronger, like, perfumes and all that now tend to smell nasty to them, like onions, garlic, things like that. Also, the taste has changed quite a bit. So
Wow.
that's the interesting part that we so much we don't know about COVID.
Huh. Oh, that's really, really interesting. Well, I've been seeing an influx of people asking me questions since they got
Yep.
sick with COVID. So I'm sure you're seeing something similar in your practice as well, huh?
It's the big jump is, interesting, so interesting what we're seeing after COVID. I mean, a lot get vestibular migraine after COVID. I've seen quite a few vestibular migraines after COVID, triple P
Okay.
after COVID, MDDS after COVID, BPPV after COVID, which is interesting. I think, and the thing that
Wow.
makes it also a little difficult is because, you also can get like the cardiac issues, the breathing issues, the
Yeah.
autonomic issues after COVID. They also present with, guess what, dizziness, right? But, it's slightly
Okay.
different type of dizziness. And so it makes it,
Okay.
very interesting.
Well, that'll be a whole nother section. It sounds like we could talk about that
Part
for a long
two.
time. Let's move on to a little bit, a few medication questions. So, What are some of your best acute treatments for patients in your practice? I do have a blog post on this, but I'd love to update it because there's so much out there now. And now we have Nurtec and some of these other treatments that don't have the same limitations that triptans have. So can you kind of explain some of your favorites?
So no particular favorites.
Okay, no favorites.
all of them work, right? So all of
Okay.
them can work. It depends on each person, as with
Yeah.
everything. So, like the ones that, you have made famous, of course, our dear friend, the timolol eye drops. They do work. Absolutely. Do they work 100%? No, right? Because,
Yeah.
there's nothing that's 100%. Right, so everything can potentially work. The triptans work very well. So, we also cannot let they're old medications, but old doesn't mean bad, right? The triptans do work. So, sumatriptan, rizatriptan, elatriptan, naratriptan, zolmitriptan, 7 members of the family, they all can potentially work. The drawback, like you mentioned, of course, would be, you can get the medication overuse headache issues with the triptans. Don't
Okay.
forget our friends, the over-the-counter, pain medications, Advil,
Yeah.
Tylenol, which again, surprisingly, right? We thought, those would mainly deal with headache, but I do have some patients who find that it helps their vestibular symptoms too, right? So,
Really?
get
Okay.
rid of a migraine again, trigeminal vestibular
That's
system.
it's
They are very
very
close
interesting.
friends.
Okay.
Find out it works, and so if that works, perfect, go for it, right?
Okay.
And then combining the over-the-counter pain meds, say, Advil, naproxen, with the triptans increases efficacy too. So we also know that. So now the trouble with that whole group, the over-the-counter pain meds, and the triptans, medication overuse headache. So we have to be a little cautious from that standpoint. Don't use it too frequently. If not, you get the
Yeah.
medication overuse headache. Now, the benzodiazepines, often malign, but definitely also can work. You have
Yeah.
the ones like, of course, the Valium, you have Ativan, you have clonazepam, all can work. The only one I don't like to use, and tell this to everyone, Xanax, because Xanax is too short acting, has a high
Yeah.
addiction potential. It can be helpful in people who have like short attacks. And you can,
Okay.
have the ones that, absorb faster to break the shorter attacks. But by and large, I really don't use much Xanax in our patients.
Okay.
Then you have the anti-nausea medications, right? You have promethazine. That thing can make you a little bit sleepy, but we know it's very effective. You have, Zofran or ondansetron, which also can help with nausea. The ones that, seems to be prescribed to every single person, meclizine, you know,
Yeah.
eh, most people it really doesn't do much. But again, there are people who find that it does help. If it helps, you can
Okay.
take it, but majority of people, I'm not a big fan of meclizine in general, right?
Neither am
Now, the newer
I. Yeah.
now, the newer ones that are out, so you have Ubrelvy, right? So that
Okay.
one is, the one of the G-pens. The G-pens are the class of oral medications that block CGRP, and then you have Nurtec as well. Main difference between the two is, the Ubrelvy, you take it once, and then you can repeat it 2 hours later. And there are 2 doses. There's a 50 milligrams, there's 100 milligrams,
Okay.
and then you have Nurtec, which is a flat dose, 75 milligrams. You just take that once at the onset of the migraine. Ubrelvy is a little bit, shorter acting, whereas, in Nurtec, the clinical trial showed that it could keep a migraine attack away for up to 48 hours, which is really good,
Okay.
and which is why they also started to use it for prevention, right?
Yeah.
Both of those can work. Both of those work well for some patients, but again, no magic bullet, not 100%. Some people it doesn't work, right? And so, if it doesn't work, it doesn't work. If it works, then great. The only drawback, of course, insurance approval. What can we do, right?
Yeah.
And like what we talked about earlier, the neuromodulation too. You have the Cefaly device, you have the
Yeah.
gammaCore, which all could work. Their review, I've not tried yet. I would be, interested to see whether it can work or not.
Do you have patients who benefit from taking extra magnesium during attacks or?
Absolutely. I forgot completely. So you have the
Yeah.
supplements too. The extra magnesium, doing the ginger, and I think your favorite, the sea bands, those also
Yeah.
can help. Those also can work, and I've heard like, where is that place? Whole Foods. I think somebody told me that they had this shot now for migraine or for nausea. Basically it's like ginger combined with some other juices. Something like I've not seen
Okay.
it. I forget what name it is, but I've heard somebody mention that to me before.
Interesting. I'll have to be on the lookout for that. That's a good thing because ginger has been used in some studies to show it helps with
Yep,
attacks. So that's a good point.
absolutely. And melatonin.
Uh,
So in children,
Oh,
so the
yeah.
study is interesting one. So, in children with a migraine attack, taking a melatonin, going to
Okay.
sleep, shown to help also get rid of a migraine attack.
Okay. Lots of options. Is there one favorite options? It sounds like maybe the Timolol eye drops or no?
In terms of, it depends on each person, right? So, if there's some
Okay.
who don't want to use the oral medications, they want to try just the eye drops, sure, go for that.
Yeah.
Or if they want to use the devices, can go for that. All of them work. There's no, way of saying, this is the only one or this is the best one. They all can work.
Yeah, I did get a question. So some doctors are hesitant to prescribe them. Do you have advice for patients who want to try some of these treatments, but their doctors are hesitant?
So, the part I understand. So, unfortunately, if you're not familiar with particular medication, of course, you'll be hesitant to prescribe it. I mean, I wouldn't prescribe things that I am not,
Familiar
familiar
with?
with because, again, we don't know what could happen, right? So, a good example is, say for migraine control, you have like flunarizine and cynarazine that are used overseas. Those are not approved to be used in the States. So I don't have, experience with those medications. I can't tell a person, okay, you'll start at this dose, move to that dose. I wouldn't know much about it. So, it's not surprising that, they have a little bit of hesitancy with some of the medications that could potentially be, a little more exotic, quote unquote, right? Or
Yeah.
and if you don't have any, if they're not something that they prescribe, usually, of course, I don't think that they would want to prescribe it because you could be liable if there's any issues that arise from that.
Okay.
Best advice is, if you have a physician who doesn't, are not comfortable prescribing particular ones, you may need to, find somebody, who can help your condition and who's willing to, prescribe certain things for you, right?
Yeah.
If you say, when, like your primary doctor, right? For example, if they're managing certain things, but they're not comfortable prescribing certain migraine medications, then, just work with your primary doctor managing your other issues. You may need to find like, a person who can help with your migraine instead.
Okay.
Yep.
Um, we kind of talked about this a little bit, but do you feel that CGRP has been overhyped, or is it really the best thing ever? And then how long can it take to see results?
So it's not the best thing ever, right? I mean, it's a very, very interesting area for research. It's a new group of medications. And so, in
Yeah.
terms of, advancing the field of treatments and, increasing the variety of treatments that are available to us, it's very exciting in that sense.
And just
But
focus on migraine because before that, we didn't
correct.
really have any medications that were
Exactly.
specific. Yeah.
Yep, it looks like, like in the last few years now, finally, like migraine has been getting, the attention that it needs. And,
Right.
it's more and more drugs are being developed for that. I mean, multiple sclerosis, there's a huge focus on that, for the longest time. But, from the world of neurology, right? Huge focus on multiple sclerosis. Many, many drugs are being developed. But, again, the number of patients who are afflicted with multiple sclerosis is much fewer compared to migraine. And so, there's a big unmet need here. The good
Yeah.
thing is that, now we are starting to develop more with the CGRP inhibitors. It can work. Again, it's not 100%, right? From what I understand, like so in the clinical trials, it is similar in efficacy to a lot of the medications that we have used before in migraines. It's in some people, it's almost magical, right? They call them the super responders to CGRP, where use it and takes away the symptoms, controls everything beautifully. But you also have, on the other hand, the non-responders, right? So where it doesn't work, basically, right? And then you have people somewhere in the middle. Yeah, it does help some, but maybe not, entirely, right? We still have to use some of the other medications or the other treatments to help control it adequately. The injectable ones you have Aimovig, Emgality, Ajovy, unfortunately, the good thing about them is, they're pretty safe, right? Aimovig
Hmm.
has the black box warning about, causing hypertension, but it's rare, but could be potentially serious.
Okay.
Constipation is, can be a very serious issue with some people with the medications, but again, serious constipation is like super rare with it. The main trouble with them is, you have to give them time to work. Unfortunately, you cannot try
Yeah.
and, unlike with the older medications, we say about, 2 months, right? With the newer ones, the injectable ones, you kind of have to wait for about 6 to 12 months sometimes for you to
About
really
12
gauge
months.
this. Yep, 6 to 12 months, right? So,
Yeah.
if we cannot, I would say I advise my patients not to give up too early on them, right? So if you've been started on,
Okay.
say, the injectables, don't give up too early. Don't, stop at 2 months and say, oh, I'm not better. I don't want to use it anymore. As long as, it's been safe for you, it's not causing any bad side effects, you should continue using them.
Okay.
DG pens, so you have, Qulipta, you have Nurtec. Now, the good thing about them is, they're similar in the sense to the other oral medications where, you tend to see the benefit early onset about the 2 month mark. Yeah.
Okay. Wow. All right. So do you usually combine the two because one you see faster results than the other, or how does that work?
If we could combine the two, life would be much better. But unfortunately, the
You
insurance
can't.
companies will throw a fit. They will have a seizure, drop on the floor, roll around, scream as if they are possessed by demons. If we try and prescribe them all together, right? So you
Wow.
can't
Okay.
get approval for that. If we look at the use of rescue, say if you use for Nurtec for rescue or Ubrelvy for rescue while using the injectables, that was shown to help, right, in some of the
Okay.
patients. So I believe the trial was I think it showed one of the injectables. I believe it's Aimovig, and I want to say Ubrelvy. I don't quote me on that. It could be that, but they're basically combining like
Right.
the oral G-pen for rescue, and excuse me, and using the injectables was shown to be more effective, right? We've not
Hmm.
seen, combining the oral G-pens for prevention and the injectables. We don't know what would happen yet. Some say don't do it because you don't want to block too much CGRP. But
Okay.
I think the more practical reason is, your insurance companies will never let that go.
Huh. So do you try to usually combine them with a different type of medication? Do they find that more acceptable, or, maybe something like, the benzodiazepines or something like that? Or how does that
Some of the older
usually?
ones, I mean, you have the antidepressants, you have the anti-epileptic
Yeah.
medications, the beta blockers, all that stuff can be combined with that.
Yeah.
Botox can be combined with it too.
Botox.
Yep. So,
Okay.
there's more evidence that combining Botox and one of the injectable medic CGRP blockers is more effective for migraine control than using either separately. But, again, some insurance companies are okay with it too. A lot refuse to approve it, unfortunately.
Okay, that's really good to know for many people, I'm sure. Someone who has mentioned they have failed all medications and all diet changes. What do you recommend?
What do we have to see what the medications are, right? Cannot be all
Yeah,
medications. There's
that I.
always sometimes the more conventional medications can be filled, right?
Okay.
But then if you fail the more conventional ones, then that's when we start to explore the less commonly used ones.
Okay, what would those be? The less commonly used.
So you have the ones that are not as used as often would be like, say, example off the top of my head, let's say like, memantine, for example,
Okay.
Namenda. That's one that's, very rarely used.
Yeah.
You have the other anti-seizure medications, say, Keppra, which, again, very rarely used, but has been shown to potentially help in some people.
Okay.
Then you have, the slightly different tricyclic antidepressants, say decipramine, not often used, but can also work. You have, like protriptyline, can also potentially work. You have, like say Singular, Montelukast, which can help with allergies. They report that it's helpful, but, from personal experience, it's not as I have not been as impressed with them as that with
Yeah.
that one so far. Um, then you have say like candy sartan, which is one of the ACE receptor blockers.
Okay.
Which people use it for headache, not as commonly used in vestibular migraine, but again could potentially be used. What else are we looking at? And of course, like say the newer CGRP blockers. So what potentially have not tried them, so far.
Yeah.
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 And so there's
From a
always
patient
options.
perspective, I've noticed that sometimes it can be a combination of things. And so, maybe one thing doesn't work on its own, but like paired
Yep.
with something else, it can work.
There we go.
I
Absolutely.
and I feel like a lot of people haven't tried the new devices too. So combining those sometimes can be effective as well.
Very
So
true.
yeah, I remember them talking about this actually at the Migraine World Summit one year, and I said, I think it was Dr. Dodick who said it would take a lifetime to try all the combinations that are out there.
Exactly.
So
There's so many different ones. I mean, like lamotrigine, for
yeah,
example, right?
yeah,
It may be, it have some, what do you call that? Synergistic effects, say with, other medications too, like the
okay,
antidepressants. So combining them definitely can be useful. Or, if you have given up too early, that's the other problem. So if you've taken it like 2 weeks, and, unfortunately, there's some of our patients
yeah,
that say, they take it for 2 weeks and they don't get better, but they weren't counseled about having to wait for it to work. They were taken off the medications, or there's some who got side effects with the medication, but from too high of a dose to start off with, right? If you start at a
okay.
whopping dose, you run into problems, and then you give up on the medication, too early. You could have done well at a low dose, and then gradually
Yeah.
increase the dosage.
Actually,
It's
I see
always,
that quite a bit. Like people are starting way too high and they're having all the side effects.
correct.
Yeah.
Yeah,
So
familiarity with the medications is also an issue, right? So, like when I first started too, I started off with like conventional doses of the medication. Then I learned over
yeah,
time that, a lot of our patients, tend to be extremely sensitive to, medications. It's not migraine brain sensitive to everything, right? And so, I learned from them, all right, everyone, tiny dose first, and then we'll see how you do. And then gradually we inch up on the dosage for everything, not just, one
yeah.
single medication.
No, I appreciate you saying that. Just that it's nice to hear that doctors don't always think that they're right. Like sometimes, you learn as you go, just like any of us.
Always learning, right? I mean,
Yeah,
that's how I learned about the Cefaly and dizziness.
yeah,
We learn.
yeah.
You have to be, sometimes just be crazy enough to try something,
I think that
as long
makes
as
you
it's
what
safe.
I think that's what makes you such a fantastic doctor. And the big difference that I noticed from
Yeah.
all the doctors I started out with is you were very much a doctor who was a partner in my health versus being someone who was like, okay, this is what we're going to do. You have to do this. It's my way. Like, I'm not going to listen to what you have to say. And it's interesting to see all the people who've started seeing you now through teleconference, just all over the world. And we all have different treatment plans, but we all see the same doctor. It's definitely not one size fits all.
Not at all. Everyone is
Yeah.
different. We have to find something that works for each person. There are many roads that lead to paradise.
We are almost wrapping up on our time, but we have a lot of questions that we've missed. I
So,
do want to ask you one more. We'll save them for next time, but
now,
uh, let me ask. Oh, we did get quite a few questions about people having strange symptoms like numbness or tingling in their legs during an attack, tremors or sensations like that. I think you mentioned it earlier, but are those common symptoms with vestibular migraine or do they indicate something else?
So the important thing is if you have any new neurological symptoms, let your neurologist know. Don't just attribute that to migraine, right? That's the main thing to remember. If you have a
Mhm.
particular symptom that often happens with your migraine attacks, or it's something that's been going on for some time, and you see a pattern with the migraine attacks, then it's safe to associate that with the migraine attacks. Bear that in mind, right? Because as much as we like, you can have migraine and other problems, right? So you could have a stroke, right? So don't, for
Yeah.
example, is, if you suddenly get paralyzed on one side of your body, don't be like, oh, it's my migraine, when you've
Yeah.
never had the paralysis before, right? Go
Right.
immediately, you could be having a stroke, for goodness sake, right? If you suddenly develop new onset numbness, say if your half your face goes numb when you've never had that before, don't immediately
Okay.
assume that it's migraine. Get checked out for that, right? But if you consistently have it with a migraine attack, then it's safe to attribute it to the migraine attack. Now, that being said, a huge variety of weird symptoms can happen with migraine attacks. It's so, I think it'll take a whole, long time for us to even figure out every single thing. Tremors can happen, weird pains in different parts of the body can happen. Numbness, tingling, and all that can happen at different parts of the body. You may
Okay.
have even like changes in pupil sizes. In some people, eyelids can get droopy, face can turn red. I've had one patient, a couple of patients actually, who swear like, the back of their neck actually like swells up when they have a
Yeah.
migraine attack. So many different things can happen. And, we learn so much as we go along. I mean, like the Alice in Wonderland type of symptoms, also actually, pretty common with people who have migraine, and it's bizarre type of symptoms. Body parts go missing, body parts are different sizes, visually things change, many bizarre symptoms can happen with a migraine attack. It's, impossible to, cover all of them, I think.
Wow. And there's one question I always love to end on, and we get asked this all the time, but can you cure vestibular migraine, or is there, or, can you recover from it?
So cure, I would say, is not possible, unfortunately, because it's genetic. It's with you, for life. The thing is, it's very treatable, meaning it can be brought under good control. You can go back to normal life, and a lot of times, like yourself, right? Once things are
Yeah.
under great control, most of the time, it stays under pretty good control, unless something happens. So COVID. Going back to the whole COVID question, a lot
Yeah.
of our patients whose symptoms were like really well controlled, and then off, some of them even off their meds, when they caught COVID, unfortunately, things ramp up again. So they can come back from time to time if something happens, but they're still very treatable condition.
Did they have to get back on their meds for a little while, or how does that work?
So it's still early on, right? It's hard to say. So,
Yeah.
a lot of times, we can give like the rescue medications,
Yeah.
like quote unquote the migraine cocktail, right? Steroids
Yeah.
and all that stuff to try and tamp things down. And some people it settles down again and it doesn't cause any issues. Some have had to
Okay.
go back on some of their meds, some have had to, go on like slightly longer term, like benzodiazepines to, calm things down. And of course, we can always start weaning again, once we see things are nicely controlled.
That's a great point, is that you don't have to be on your medications forever.
Absolutely.
When do you see a good point for patients to wean off of those?
Generally, if you're like super stable for at least, in my just personal opinion, right? So, once I see you've been like super stable for at least 6 months, a year, and if you're
Okay.
interested in weaning at a time, then we can definitely do that. I mean, of course, if you want to get pregnant earlier on, let's say, right, and you want to wean earlier, then of course we have to wean if you're on something that you shouldn't be on while pregnant.
Yeah. Okay. Well, thank you so much for your time today. And I just want to mention, people can find you on Twitter at the Dizzy Doc. But also, what's a good way? You are seeing patients from all over the world. How do they get in touch with you?
You can email our office. That's the best way. We'll take care of you. So it's office@vestibularmd.com, or you can go to the website, vestibularmd.com. It has our phone number there, fax number there. We don't need a referral. You just contact us, let us know, and then we can get you set up.
Thank you so much. I'm sure this will bring you many more patients, even though you have so many already. But I hope
Always
that
glad
this
to help.
allows them to come see you and get the help that they need, just like I did.
Glad to.
Yeah, thank you so much, Dr. Beh. We'll see you again soon. And I just want to mention that we also have a new book coming out, Dr. Beh and I. It will be released hopefully in October, if we can get our edits in on time. But this will be called The Mediterranean Migraine Diet, and it will be a book that combines the science with great recipes on how to eat best for your brain health.
Absolutely. And gut
Yeah.
health.
In gut health, yes, very,
Mm.
very good point. Thank you so much. We'll talk to you later.
Okay.
Bye.
Bye.